evening. Thank you, David, and thank you everyone who's attending. It is both a pleasure and an honor to be asked to share my 19 years of diode laser experience and use in my practice with you. That doesn't date me because I'm not going to tell you how long I've actually been in dentistry. So good evening, and I really appreciate everybody joining. This, of course, as everyone, I've been stuffed in the house with these beautiful, lovely people lately. So these are my pride and joy that I love spending time with. And I'm going to read a small disclosure, just so you're aware that the content, the recommendations, and the views expressed in this course are solely those of the presenter, me. And these are my opinions about the products and the protocols that I use currently in my practice. I'm going to talk about the what, the why, the what, and the how. And first, I'd like to read this about the American Academy of Periodontology. Periodontal health should be achieved in the least invasive and most cost-effective manner to the patients. And I believe that's exactly what the laser allows you to provide to your patients. It's how I practice with the laser and how I practice overall dentistry with my patients is the least invasive and the most cost-effective manner possible. So why the diode laser therapy is right for your practice. Well, incorporating the laser therapy on a daily basis offers numerous benefits to the overall health of the practice, the clinician, and the patients. And of course, I've experienced that firsthand. Utilizes the latest advances in technology and dentistry. Nowadays, patients are really looking for those latest advances in a lot of different technologies that we have. It enhances the patient experience, their overall experience in your practice. And I do believe it's a higher standard of care. And hopefully by the end of this, you'll feel the same way. If you've already had the laser, you might already have experienced that. And if you're here new today, seeking out more information to see if this is something you should implement in your practice, hopefully by the end of this, you'll feel the same way. So I wrote an article a little ways back, and one of the things that I like to focus on is relationship building and a holistic approach to dentistry. And of course I do mean organic and natural, but more than that, I mean a whole body experience. So really looking at the health and everything about the patient, it's very near and dear to my heart. And what this for me allows me to do is comprehensive dentistry and looking at what approach is going to best fit my patient. So we all know, say this over and over again, that the head and the body are connected, and we cannot truly have a healthy body without a healthy mouth. So with this ever-evolving dentistry and the new challenges that we're faced with all the time, microbes getting smarter, and always changing, we really need to step up and continuously explore ways to keep everything in check. So I feel like years ago that we didn't know, well, we didn't pay attention to the body and the mouth being as connected as we do now. And we didn't really realize that we were defending against all these systemic issues like cardiovascular disease and diabetes. And now that we do, I think taking a look at a bigger picture and taking it into consideration when treating our patients best serves them. And I believe having the knowledge and the tools that can best aid in this is a win-win for me and my patients, and hopefully you and yours. And for me, that is the laser. So the benefits to the practice as a whole is obviously patients are more educated and seeking out more advanced care, levels of care. And so they're looking on websites, they're looking on social media, and they're asking their friends and family, and they're getting educated on this. So they're out seeking this. This is safe for infant, pediatric, and adult patients, and solutions for pregnant or nursing mothers. So what's great about this, and medically compromised. So what's great about this is it allows them to provide an alternative solution for contraindications from the patients. So if they have a current health status, like even just being pregnant, if they have allergies to any medications, or some just don't want anything chemical, anything not natural in their mouth or in their body. So I don't know about you, but I've had patients, when I've wanted to do something like place an antibiotic somewhere site specific, sometimes they'll tend to not completely understand, and they think that antibiotic is, like taking an oral antibiotic. And even after explaining, I still get a big no. So with this, because of the no contraindications, it's a much easier conversation for me. Not to mention the time it takes me to do it, the cost of the patient, post-op period, and all the do's and don'ts when you use other alternative methods. It's more precise and conservative compared to conventional treatment modalities, and it increases retention and attracts new patients, much like what I talked about in the first bullet point, that they're seeking out alternative methods. So the benefits for the hygienist, and I just want to say that all of these are benefits to the patient, to the practice, to the hygienist, but individually, it's what's going to be important to us. So patients aren't going to understand, precise targeted disease tissue. So I have broke it down like this. So benefits for us as a hygienist is we can precisely target those disease tissues. So in the past, for me, anyways, in my experience, when you're in there with a scaler, it can't differentiate between good tissue, nice healthy tissue, and bad tissue. When I'm in there cleaning, I'm causing some damage to the tissue, and with this, I'm able to precisely target disease tissue, which makes me very happy. It treats, it manages, and may even reverse gum disease depending on the severity and what's going on with the patient, by eliminating the need for painful and costly surgical procedures. So I always love if there's any way that I can prevent more money, more time, and referring my patients out. It improves blood flow to aid in rapid healing. It increases hemostasis, overall patient comfort and healing time and process, and confidence that you're providing an enhanced solution for periodontal care. So I have very much confidence when I'm doing this that I feel that I'm giving my patients the very best care. And since, according to the CDC, periodontal disease affects 47% of the population over 30, not only is this periodontal disease destroying the supporting structures around the tooth, but again, it's a chronic inflammatory process that's affecting our whole body. And because of the reduction of the bacteria with my diode laser, when I'm in there, it reduces the risk of it into the bloodstream and helps the healing process. And I want every tool possible to protect my patient and to treat my patients. So the benefits for the hygienist with pain therapy, you're going to stimulate cellular function and temporarily increase the blood circulation, increase vasodilation, which creates an anti-inflammatory effect, promote wound healing and tissue regeneration, and promote that, modulates immune system, and topical heating that elevates tissue temperature, creating a temporary relief of minor muscle and joint pain and stiffness. So I look at this as like an organic muscle relaxer that optimizes patient comfort. For me, it reduces the amounts of rescheduled appointments or wasted timeshare, because if somebody comes in with some discomfort and it's flared up and they're unable to open their mouth wide or hold their mouth open, and they don't want me to do a lengthy procedure or take radiographs or something on there, I'm able to treat them and they're able to open, and I can access adequately to treat them appropriately. And on top of that, they have reduced pain, so reduced anxiety, and I can focus on treating them rather than, the psychology of them being stressed. And benefits for the patient. Again, increased patient comfort. That's good for all of us. Again, it showcases the office that it's up to date on technology, and we always want that. Again, people are looking for that these days. It instills confidence, builds trust, and strengthens the patient relationship. When they have an experience, in my experience, when my patients experience this, they know that I'm taking a holistic approach. They know that I'm looking at their overall health. They know that I've taken the time to go learn and invest, and they understand where I'm coming from when I explain it. So it really strengthens that relationship with me. Of course, accelerated healing. We always want them to be comfortable and heal as fast as possible. And I found that it's less opioid prescriptions, so less analgesics all the way around. There, you know, no more, not as uncomfortable. So no need for stuff like that. And again, it sends that message to your patient that you care. So what are diode lasers? There are many types out there. I've in my time have used quite a few of them. And so you have to find what works best in your practice, not only financially, ease of use, just what price point, anything. I always recommend taking a look at all of them and see what best fits in your practice. And we'll get a little more into some of the differences as we go. I was lucky enough to be part of the production of the Epic Hygiene. It was made by Hygienist for Hygienist. And some of the things that I just want to point out why I took such pride in doing this was the intuitiveness of it. So the simplification of it, it's so easy to use, the implementation and the ergonomics. You know, we have a lot of fatigue in our profession. So whenever I can do anything to help with that, I always love to do that. And then I love the 8-hour rechargeable battery. You know, you're able to move that around with ease. We all have cords and everything in our operatory. So anything we can do to cut down on that. And I think, again, it's a great practice builder just because we're able to, and when I say market that, of course, I mean market it for a good reason, that it's helping our patients. Let's talk a little bit about the safety. Safety is really important. And when you see this cute little gadget, you're not thinking, how much can actually go into it. But I just want to talk about a few points. Number one, check with your state practice act to ensure the laser use within your scope of practice. You can ask your dental board. The ALD has a great resource, ald.org, for that, but always check with your dental board on what you can actually do in your scope of practice versus can't. Take a laser certification course. So some of these states will have gray areas and may not say that you have to take it, but just like any technology, when you get it in your practice, you want to understand how to use it, how to talk about it, how to be safe with it. So that's what a laser certification course is going to do for you. Educate yourself on the laser technology and therapy. So there's articles, there's a lot of great resources out there, and just always reading up on the different things that it can do for your patients. Read the manual. I know that's super fun. But that every device has specific guidelines according to their manual. So you want to make sure that you understand those guidelines for the diode laser that you invest in. Obtain required laser safety training. So usually there'll be a laser safety officer and they will be required some safety training. We want to wear a level 3, class 3.1 micron mask while we're using the diode laser. And of course, always, always, always high volume evacuation. So that's one thing we want to make sure we're always using. The tip disposal is also important. These are little pieces of shards of glass or quartz. They are sharp, and we want to make sure that we're disposing of them in the sharps container. And then I suggest, not reusing them. Some of the diode lasers will come with a fiber optic cable that is autoclavable and cleavable, and you'll use that same cable cleave it and use a different part of it. And then some tips are preset and disposable for one-time use. So you want to make sure that after you use those, you get rid of them and into the tips disposal or in the sharps disposal. And of course, whichever laser you pick, you might have options with that on which tip you're using. Combustibles. It is a high power laser energy that can ignite materials. So you never want to lay this on a patient bib. We don't want to set the bib on fire. You have to watch around other things, gauze, any kind of material. You just want to make sure if your foot hits that pedal. You know, I never want to use my patient as a tray table anyway. So just put that handle back into the laser where it belongs when it's not in use. Oxygen and nitrous oxide may be used with proper scavenger and suction techniques, so you can use that while you're using the laser. If the patient is on oxygen though, you want to leave that tank outside the nominal hazard zone. You want to avoid laser use with alcohol-based aesthetics and remove all potential flammable oil-based lip products such as petroleum jelly. And only wipe the laser tip with dry or water moistened gauze, never alcohol. So ANSI is the American National Standard Institute. So it's going to talk about the safe use for all types of laser. The nominal hazard zone, which I just talked about, is the room itself. So it's that operatory that you're doing the laser in. The nominal ocular hazard distance is essentially where you're treating, where you have that laser on, which is obviously typically the patient's mouth, how far away you need to be that you wouldn't need safety glasses, you wouldn't have any damage to the cornea or the skin. And you're gonna wanna look in the owner's manual for this because it's gonna vary laser to laser. And the laser safety officer, which I talked about, is going to ensure the guidelines are followed in the practice. Two things, or one thing that I didn't mention on here is the safety glasses that you use. Be sure each one of them on the site or somewhere on them will talk about the wavelength that they can be used with. So you're going to want to match that laser with the safety glasses. Now, obviously, when you purchase a new one, it's going to come with those. But sometimes we, in practices, if you've been practicing long enough, or you lose a pair and someone lets you use them, you know, you want to make sure that those match up in wavelengths so that you and your patient are both protected. Okay, laser bacterial reduction is what else you can do in your practice. So this is administering low-powered laser energy within the sulcus throughout the mouth. And what that does is sulcular decontamination. So it's going to reduce the debris and it's going to reduce the inflammation risk. It reduces the risk of bacteremia, which in my patient's mouth, the reason I do that is because I want to prevent cross-contamination within the mouth and reduce the gram-negative bacterial load that could potentially be entered into the bloodstream. And encourage healthy cellular function. So it stimulates new cell growth and promotes healing of the tissue. I also use it for laser-assisted periodontal therapy for sulcular debridement. And again, let me just back that up. Laser-assisted periodontal therapy is administering the laser energy within the periodontal pocket for profound decontamination. And that will result in tissue interaction when you do that. So sulcular debridement, and you just want to check again with your state scope of practice to see if that's something that you can do. It eliminates the periodontal pathogens, and it encourages reattachment and cultivates a healthy microbiome. So in my experience, I've been lucky enough to use lasers for, like I said, 19 years, but I have helped other hygienists incorporate lasers into their practice. I've also temped and many practices over the years. And for me, it's day and night. The difference in the pocket reduction and the way that reattachment happens for me, and this is my experience. So I've helped hygienists do this, and you know, at first I may get things like, I don't see a difference. How do I know I'm doing it right? And I just, you know, one of the things is trust the science behind it, trust the laser. And sometimes it is over time. So it takes a couple of treatments before you see it. But I will say, once you see the difference, once you hear your patient say that it felt really good, that the tissue already feels tight and they can feel the healing process already, it really excites you, and then you're ready to use it on everybody. So that's really awesome. And again, they usually don't need any analgesics for discomfort. So I'm not having to, you know, give them Advil or Tylenol before they leave, because this gram-negative bacteria, or this laser, is attracted to that gram-negative bacteria without damaging the tissue around it. And that's why I love it so much. Okay, this is my favorite. Well, it's not my favorite, but it's rings closest to me and my experience with it. So laser treatment of Aphthous ulcers and herpetic lesions. First of all, I want to make sure that our patients call when they feel that prodromal phase, so that throbbing. This really, for me, is a very nice, easy introduction for the laser into your practice, because it's very easy to use. You don't have to have the fear of putting it down into the sulcus, and the benefit of it is really amazing. So the laser energy destroys the surface, viral or microbial etiology. It inactivates the lesion and stimulates healing, which is really great. And it cauterizes the nerve endings so symptoms subside. So essentially it provides pain management, it speeds up the healing, it decreases the duration. And I myself went through all my high school years getting fever blisters, and they're embarrassing, and people feel the need to point them out and tell you that you have them and you're very aware. And I can't tell you how many times I begged my mom to let me stay home. So that's probably why I've done lasers almost my entire hygiene career, was because once I knew that I could provide this benefit and treat these lesions for my patients, it was super exciting. I was in there, you know, doing mine all the time, every time I got one. And the great thing about it is, you know, it costs a little money, but it really costs less than always being on or constantly having to get a cyclovir or a Breva from the store. And then guess what? You know, they come back over and over again. Now, I never tell my patient that I'm going to treat this and it's not going to come back. But what I have experienced is use over time has not only, sometimes it always, for me, has decreased the duration, has made the lesion much smaller. But in my case, in some of my patients' cases, it actually does not come back in that spot anymore. And when it has come back, it's been so tiny that it's almost like it lasts for like a couple of days. It never gets to that place where it scabs over and everything. So I can't say enough, obviously, about using it for that. These are some of the other applications of the diode laser in dentistry. There are so many benefits and so many ways it can bring, you know, treatments to the patient, technology and efficiency to you. And yes, some of this is doctor only, and some of it you won't be able to do in your state at all. So really, I put this up there just to let you know that it does so much more than probably we even ever utilize it for. So how do we incorporate lasers into your practice? That's what we all want to know, right? How do we do this? So the first thing I'm going to do is I'm going to treat it like any other appointment, in the fact that I'm going to make sure that I conduct a thorough medical history, because remember, I want to connect the dots of the etiology of, you know, why do they have infection? you know, different things that are going on, I always want to make sure that I have the health history behind it. So when I talk to them, I can tell them how it may help with that. Obtain the appropriate radiographs and diagnostic records. Confirm that they've received a thorough, comprehensive soft tissue and periodontal evaluation. And then, of course, discussing the findings with the patient to ensure they have a full, comprehensive idea of what this recommended treatment is going to be. So all that is super important. And then establishing that treatment plan, we're going to review all the necessary commitments for treatment time, any related cost, and of course, home care required to ensure that optimal treatment outcome. You know, the last thing you want to do is do something on a patient and them not have full understanding and not be happy. So I always want to make sure that I'm setting us up for success and my patients up for success. If you're the only hygienist in the practice, it's super easy. You just want to make sure that you're always set up and ready to go, just like you would an operatory. There's nothing worse than going to grab it and you forgot that you didn't, you know, wipe it down, you didn't change the tip or cleave the tip or whatever it is. You want to make sure that when you're done using it, that you get it ready to go. And it's even more important when you're sharing it, because if someone comes to grab it, because you have to share it, time is very limited. So if it's not ready for them, you know, that creates frustration on their part. So you want it on a cart or on a counter, very, very easy, right there, ready to go. And you want to make sure that it's always clean. I know, being a hygienist for all the years that I have been, is that if I have to go find it, if I have to go get it, you know, obviously in that moment, I'm probably going to continue to use it because I've already either told the patient or have a plan, but it's not going to be consistent. I'm going to fail at the use of it. So the more ready, the tighter the protocol, the more agreements that I have in place with, especially if I'm sharing, the more successful we're all going to be in using it. And then of course our patients are going to be the ones that reap the reward. If you want more lasers, I'm going to talk about that in a minute, but track your income and usage to show your doctor. There's nothing wrong with that. Be prepared to talk to your patient about the benefits of diode lasers. If the patient has to ask questions, we're already creating a barrier to yes, because things are already running through their mind with objections and things that they might be concerned with. So this is part of the influential communication that I came up with. Now, I want you to know that as I'm reading this, I am going to connect the dots with my patients. I'm going to connect the dots of the findings in their mouth. I'm going to connect the dots with their comprehensive health history that I've done. But what I've done is comprise some talking points. If I can get all of this in, I've addressed all of my patients' concerns. So upon reviewing your health history and periodontal charting, I am concerned with the areas of significant pocket depth and bleeding and or inflammation if they don't have pocket depth, whatever you're seeing. I know you take pride in the care of your teeth and gums. Bleeding in your gums is a sign of infection. The bone and the gum are the foundation for all of your teeth and the dental work that you've had and invested in. Your condition will not improve without proper treatment. I know if left untreated, this will result in bone loss and breakdown of your supporting gum and bone. Part of my hygiene therapy today includes the use of a diode laser. It reduces the bacteria entering into your bloodstream. It stimulates your body to heal itself, and it will be comfortable. It does increase the fee, and generally insurance does not provide benefits for it. However, as your healthcare provider, I would much rather provide you with a more holistic, natural therapy and not a chemical one. With your permission, let's get started. And then I feel, you know, I would get started, and if a patient had objections, they're definitely going to let me know. So I'm going to give a couple of examples of here of how I document it and a little bit of the usage. Of course, it varies definitely from laser to laser. It depends on tissue type, pigmentation, bleeding, severity of the disease. So there are all kinds of factors that go into settings and how you perform the procedure. But I'm just going to give you a short synopsis of how I do it. So I do a pre-procedural, non-alcoholic pre-procedural rinse for the whole mouth. And then I'm going to do LBR or pocket therapy prior to my prophy. Now, some people will do it at the end, and it really is clinical preference. This helps with the cross-contamination and the bacteremia. I use a non-initiated tip, somewhere between 0.5, 0.8 watts in pulse mode, and I'm inserting that tip 0.5 to 0.1 millimeters into the sulcus. Of course, I'm always wearing eye protection. My patient's always wearing eye protection. And when I document, I'm going to document the time that I spent, so make sure you're keeping track of that. And for this, it takes me about 3 minutes. When you first start out, you might be a little too thorough, but 10 to 15 seconds per tooth. And then I always write down the patient's response and, of course, any post-op instructions that I gave. With LAPT or laser assisted periodontal therapy, very similar. I'm going to do the non-alcoholic pre-procedural rinse again. I'm going to perform the LBR before I start the periotherapy. Sometimes I use topical, sometimes I use local anesthetic. It really, again, depends on the clinical preference. If it's an isolated area, not as severe, and obviously the patient's pain tolerance. The tip I have on here initiated. Again, some states you cannot initiate them. Some clinicians will prefer to let the tip naturally initiate, and some clinicians will initiate the tip to get started. So again, that's why when you take this certification and you understand all this better, then you as a clinician get to make that based on your preference. Of course, time spent, laser safety glasses, and then the post-op. And I'm just going to go in a little detail about the Aphthous ulcer or herpetic lesion, because I know, this is a question always asked. Again, when you use something like the Epic Hygiene, you're able to have a preset for these things. And those presets in any laser are always suggested. So again, you have to take a lot of things into consideration, but it's there to help you not have to think about it, especially when you're first beginning your use in lasers. So it's a non-initiated tip, non-contact mode, 2 millimeters above the lesion. And you guys can read, but basically I'm increasing by 0.2 watts each time, and I'm doing about 4 passes is what I do. So I get up to 0.9, and really depends on the size of the lesion. It can take up to 90 seconds. It really just depends on that size. Hemostasis is achieved with the adequate zone of the remaining tissue is heated above 60 degrees. So we're able to do this with a non-contact coagulation. So I love that you have this ability. Sometimes you're just naturally doing it, but the heat spreads around the surrounding tissues, coagulating the blood. And you just wipe, as you do your periotherapy, you just are able to wipe that blood clot very gently around the tissue off with wet gauze, and then use a little finger pressure there to complete that hemostasis. Whitening is also, some of the lasers make it very easy. They come with an apparatus that you're able to do chairside whitening with the laser. The laser energy from the laser interacts with the chromophore and with the laser gel that activates the gel. You just want to make sure that you keep the gel off of the gums, and you want to make sure you keep the laser tip off of the gel. So it accelerates the in-office whitening, and what's great is obviously whitening your teeth always creates confidence in a natural way for your patients, and they leave usually happy. They want that more than anything. We've all experienced that. So required documentation, I've went over quite a bit. Just make sure that you're you're documenting these things. If you want to take a picture, the laser manufacturer brand, any type, the tip, the setting, and then of course I already talked about the time spent, and then the eye protection worn. So and the area lays, you just want to make sure all that's included in your documentation. And speaking of documentation, really that plays the biggest role in any reimbursement of any dental procedure. So document in your chart, provide it to the insurance companies. The DIN 9130 is really the only laser specific code to date that I'm aware of. And one of my colleagues was instrumental in getting that approved, so that's great. David's going to talk to you a little bit more at the very end about Teresa Duncan and Dr. Sam Lowe doing a coding, laser coding course, I believe on April 8th. So he'll talk to you a little bit more about that when this is over. But I'm just going to talk to you about from my point of view and what I do. So herpetic lesion, when I do that, I'm using D7410. LBR and LAPT, I actually don't use 4999. Many offices do. They're using that for the generic code, and then they're putting, like I said, a very descriptive detail on what was done. And then some people, and anyone who's watching, I know that that's not, the proper, gingivitis therapy, quadrant therapy, sextant therapy, but I know that everyone would understand what those were. I wasn't going to write out the big detailed coding, information. But some people choose to actually just incorporate that in the cost of their treatment. So they may increase their gingivitis therapy or their quadrant or their perio therapy, and then put that cost in with it, because there are some insurances out there that say that it's included. They deem it as part of the procedure, and so they don't even recognize it. But just know that most insurances out there probably are not going to assist with this. So I make sure I'm set up for a conversation with my patients right before I perform the procedure, so they have full understanding. I did a little quick return on investment just to see a little bit about like what I do in my practice. And so real quick, LBR, so laser bacterial reduction, I like to do on everybody. So at $50 for a full mouth is an approximate charge. If you had 8 patients a day, 5 days a week, that's 40 patients. This is one hygiene chair per day. If you have multiple hygienists, you can multiply that. If you have a hygienist that shares days, it's 5 days of one hygiene chair. So it's 40 patients. If you recommended it to pretty much everyone, which I recommend it to everybody, and I only enrolled 50% of my patients, that would be $1,000 a week times 4 weeks is $4,000 times 12 months is $48,000 a year. That's 48 weeks, not 52. So I feel like, 50% at 48 weeks is a pretty attainable number. I'm not going to go through the second line because I know you can read. And then the LAPT at 90 a quad, I just did 1 patient a day. So 5 patients, if you're doing 40 patients a week, that's a 12.5% enrollment. And that can bring $86,400 to the practice in a year. And then I did herpetic lesion. I just did 5 patients a month. Once, I know that seems like a lot if you're not doing this, but once you do it and patients understand and you're marketing it, 5 patients a month with an Aphthous ulcer or herpetic lesion is not, is definitely will happen. So that's an extra $138,000 of additional revenue to the hygiene chair. That's one hygienist. So just kind of showing you, what we do in my practice and how that can benefit. And then return on investment for you of your practice, it helps you run on time. Because your patients are easier, because they're healthier, there's less stress and less stress on your body, it really helps me run on time. People think it adds time, but once you get the hang of it and your patients are healthier, it helps you run on time. You expand your procedure mix. So you get to attract different patients with different technologies. You get to add a little fun to your day. You get to experience new things and talk about different things. I love it. I love doing different things all day long. It sets your practice apart by being health focused. The technology increases efficiency. I already talked about that. And for me, again, as I talked at the very beginning about hiring the standard of care, I really believe that this increases the standard of care. And how do I create value with my dentist? Well, create a business plan, real small. I've talked about all this. Discuss your commitment. Discuss, you can use that little sheet that I did before, your return on investment, ways to market it, and what is that price point? And it can instantly help grow your practice. I believe a small business plan, whenever you want any technology in your practice, is the best way to go. Sorry. Oops. Sorry about that, guys. That was my info call there. So continually advancing yourself in dentistry can make a huge difference. Always expanding your knowledge and skill set. You guys are hygienists. I'm sure there's other people on the phone besides that, but I always take pride in my profession. It's a win-win for the patient. They become advocates of their own health. And anytime that you can change a patient's health, of course, you can change their life.